Yoga, meditation, and healing therapies are not a replacement for medical treatment. I always make that disclaimer, in almost every one of my videos. And this is something, a very important point to remember. And, it's something, if you don't heed this warning, it can be highly detrimental to your life. So in this video, I'll give you an example of something, a few examples of my case studies, and explain it, from that perspective. And also remember, if you like the content of my videos, please like and subscribe. You're doing my channel a very big favor, and I'll be able to reach out to more people who need the information and education. They don't have access to this type of information. So also, for those who don't know me, my name is Osman. I am a bioenergy healer on a master level with telepathic capabilities. I specialize in critical care recovery and terminal illnesses, amongst a host of other physiological, psychological, as well as spiritual ailments, especially treating the adverse effects of involuntary Kundalini awakening. I'm also an advanced level yoga and meditation teacher, having been practicing for almost 50 years and teaching for 44 years. And in that period, I've studied under various masters and weaned the essence and what I felt is more important, and developed my own protocols that is adapted for the 21st century, right? Making it more simplified, taking out the frills, faster results, right? To that effect, I've got students now in over 100 countries, and I've created many protocols. And one of them is a 5-minute yoga and meditation program, which you can download for free from my website in return for subscribing to my blog, and which you can visit at yogawellness786.com, and also get more information on my services. Also understand my therapies are all natural based and not a replacement for medical treatment. There we go. That is the disclaimer that I always say. So I had a very good friend of mine, right? He's currently, we'll say, the best friend that I have, and probably one of the best friends I ever had, right? And he recently, if he has any problem, I will, because I can do telepathic, healing. I will send him, energy telepathically, because he's in a totally different country and a very long distance away. And usually the results work quite fast with him, because he did extensive chakra unblocking with me as well. That's how we met, right? Initially, when he came, and so he's already aligned somewhat, and the energies work quite nicely. And when he had a migraine headache, and he was having medications for it, and the medications weren't working, and then I, offered the energy healing for him. Then he also, had some, he was feeling like depressed and really out of sorts and going through a difficult patch. And he's got a history of, psychological disorders and so forth, and in the past. So immediately I didn't say, let me offer you, energy healing, because the energy healing specifically works very well with depression, right? So first thing I said, go to the doctor, but he has to make an appointment, and that appointment takes like about 2 weeks. And then from the appointment, the doctor has to get referred to a psychiatrist, and I said there's three interventions immediately that you need to take. Firstly, make the appointment with the doctor, right? This is number one, very important. And don't go resort to meditation and mindfulness and energy healing therapies, because it is something very serious. It's worse than a very wide open wound that's gashed in a car accident, and your whole thigh is ripped open, and you need an anti-tetanus shot, and you need all the energy healings. You need to go to the trauma ward, right? And you need to be treated, disinfected, and the wound to be stitched, sterilized, and stitched, right? And then you can do, after medical intervention and the medication, then you can do energy healing to speed up, the healing process and so forth, right? So similarly, psychological problems, especially like depression, anxiety and so forth, this needs very urgent medical attention, because the world is going to close to a pandemic level, according to the World Health Organization, in depression, anxiety, depression and anxiety, and the suicide rates are increasing at an alarming rate annually. No longer is it increasing on a 10-year level. Every year it's increasing annually, right? So this is something which is should be treated more dangerous than a terminal illness. Terminal illness takes about a year or 2 years, before it finishes you off. Depression can finish you off that same day. You can take your life. You can go into a deep spiral, and you can take your life, or do things that is harmful to you. Maybe strong enough not to take your life, but that the the anxiety and the stress level that increased in your body is going to bring about other chronic ailments, and probably may even bring about a cancer, you know and all types of chronic ailments related to having stress as a very significant contributory factor. So I said first step is make the appointment to the doctor. Second step, go to the, because it's going to take 2, go immediately to the pharmacy and find out if he has anything that is possible without a prescription, the over-the-counter type of medication. It'll be a little bit milder, but it can help. In the event the pharmacist got zero, which is unlikely, right? There must be some type of mild sedative that they can give you, over the counter, that can bide you until you know, meet with the doctor. And when you meet with the doctor, ask the doctor to make the appointment with the psychiatrist, because he's got a history of psychological problems. He needs, specialist help. So until he gets the appointment, because that may be another 2 to 3 weeks, appointment. So the doctor can prescribe him something stronger than the over the counter, tablet. What the doctor's got a power of prescribing, but he won't have the power to prescribe the highly specialized a drug that a psychiatrist can, prescribe. So he can get a second prescription, from there, and latch onto that. And once he go to the psychiatrist will decide which is the best course of action, right? To go, because these things is not something that's coming, on and off. It's like repeating itself once a month or once in 6 weeks and so forth, right? So yes, he's done chakra and blocking and so forth, but there are certain deeply rooted medical problems that you need to seek the medical intervention first. So, to that end, I'll give you another example. Um, I'm specialized in critical care recovery and terminal illnesses, right? So, none of the people come to me, and say, I've got a by diagnosed terminal illness, and I don't want to go the medical route. I believe you are more powerful, and you've got a very high success rate. So scrap everything. Let's do it only with you, right? I don't accept that type of clients. I say, no, first you go for medical intervention. And if all the medical interventions failing, or while you with the medical interventions, then I can, concurrently do, give my therapies, because these therapies, especially energy healing, especially yoga, meditation, and all these things. Especially yoga meditation is very mild thing, right? Yes, it has significant improvement over a long period for regular people and regular mild type of thing. But something that is serious needs medical attention. If it's occurring consistently, and you got some type of history, or it's really affecting you badly, don't take it seriously. Especially if you have teenage children and they're looking depressed and so forth. Don't just assume that they're taking drugs and having withdrawal symptoms. Take them immediately, to a doctor, and let them, go through some blood work and analysis, and put them, under treatment, medical, make sure there's medical intervention. Maybe they just need counseling or therapy, or medical, but let the experts decide on it. So coming back to the energy healing, yes, it's a very powerful, intervention, but it works complementary to medical treatment. There has to be medical treatment, and there has to be a nutritional intervention as well, right? Because the doctor will know what is deficient in your blood, and what you need to supplement on, or what foods to increase, in your diet. And while you're increasing the foods, to give you a supplement alongside, you may have, deficiency in magnesium or zinc, not just to, you know, say go to an energy healer and everything's going to be fixed. Your energy is going to be balanced and everything going to be fine. Your hormones, the energy healing, all these things. Yes, it's very powerful, but it's 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 something that is natural. Anything that's natural works slowly, right? And with the terminal illnesses, um, it works. Minimum is 14-week treatment protocol. I can't do it in one session, right? I don't have a magic pill. I give it a pill and boom, the cancer is gone. 14 weeks, and after 14 weeks, maybe there's some improvement. You have to continue for another 14, probably, 3 or 4 sets, sometimes 6 to 8 sets. 14 depends how, serious and how severe and what each individual's, responses differ, right? And even with critical care recovery, these are people already, they went for surgery, they've got all the medical intervention, they are in an intensive care unit, usually intensive care unit in hospital, and they fighting for their life. And the doctors usually say, is in a highly critical situation and he's fighting for his life, inform all the family members. They cannot give any guarantees. So this is when, I intervene that all the medical precautions are taken, right? So also, like for example, there's a doctor friend of mine who works in the intensive care unit, and he experienced someone with very severe, illness, and all the drugs failed, right? And they even did surgeries, and it didn't help, and it was progressing, and it was just worsening, and not responding. It was non-responsive, right? Not that it cannot respond. It wasn't enough. We need just that little more push. And then they asked the patient, what he wanted, because his last wishes, right? They did not expect him to survive more than a few days. He said he just wants some sunlight. And then they took him out. Of course, they did have moved, heaven and earth, to take him out and let him experience like just a 15, 20 minutes, 30 minutes of sun every day. And then suddenly everything started to work, and the medications were working, and he was discharged after a few weeks, right? And he's still okay till today. So it doesn't mean now if you're ill, dump all the medical treatment, just go and sit in the sun. The sun is going to, be a therapeutic. It's just that little bit extra, the natural therapies, it all works together. But very important, the medical intervention is number one, because you can't neglect that. This is people who studied this field, and you need to have that base covered first. And always think of the example: you're in a car crash and you got a wide open wound. You can't start meditating because it's bleeding to death. You need a paramedic to come there immediately on site to stop the bleeding. Someone need to stop the bleeding as soon as possible. You're going to bleed to death on site, right? And once you into the trauma ward, even there, when the paramedic comes, he'll give you an anti-tetanus shot on the spot. All the meditation and energy healing in the world not going to help you there, right? You need that, and the energy is not going to stitch your wound, right? Generally speaking, there's certain grandmasters who's got maybe certain powers, and then of course, if he exhibits such powers, they will put him in a laboratory and cut him up and dissect him and see how he's doing it. So even the grandmasters are afraid to do it. But that is just a side remark, and sorry, it was a bad joke. But always think of that example, right? Think of anything medical, even depression, psychological problem is worse than physical injuries because it's from inside, and it can kill you today, right? Because people, especially if you have young people or friends who's going through it, take it very seriously. Don't leave them, alone, and make sure they're getting the intervention and the chemicals. The chemicals work amazing. Immediately give them a way to cope and manage, and then therapy is going to work. Then natural healing is going to work because they've got a insurance or a safety net that's bringing them to some level of sanity. So I hope that information helps you, and take care of yourself always.